Hello beauties, and welcome back to my channel. My name is Crystal Chantel and I am a second sequence nursing student at the illustrious NYU. On this channel I'm going to be sharing all things accelerated nursing program. I'm going to be sharing things I wish that I knew or I wish I found out when I was doing some research on the program. So if this is you, sit back, grab a pen, grab some paper, grab some tea, because I'm going to be sharing all the tea. So we're going to get straight into this video. So I'm sure you saw from the title, I'm going to be sharing my 5 must-haves for my clinical rotations at NYU. So we're going to start with number 1. Okay, so number 1 is, drum roll please, a watch. A watch is super important when you are going into your clinical rotations, and I'm going to explain why. Okay, so first things first is you are a student and you have been given the privilege to practice in someone else's hospital. With that being said, you should not have your phones on you. If you do have your phone on you, it should be tucked away in your pocket at mostly all times and really just on you for emergency purposes. With that being said, you're going to need your watch to tell time. Not all hospitals just have the time posted up for your leisure. So yeah, a watch is going to be good for you to keep track of time. So patients need their medications early in the morning. When the morning shift comes, they are prepping and getting ready to give those medications out. And so it is important for you to keep your watch on in case that they give you the opportunity to give patients their insulin because they're getting ready to have breakfast. So having a watch on you is super important so that you stay on your task and make sure that you're given things at the appropriate time. Number 2, when you are assessing patients, it is important that you have a watch on you, and I'm going to explain why. So, first thing, when you're assessing a patient's lungs, you're assessing a patient's heart, you're counting respiratory rates. I understand that a lot of hospitals have their devices where they'll give you the values of the respiratory rate or give you the value of their heart rate, but let's be honest, sometimes depending on the population that you serve, they may not always have an automatic machine just lying around. So it is really important to practice those practical skills so that way when one day you don't have those automatic machines, you can do these assessments manually. And so a watch is super helpful so that you can count your respiratory rates, you can count your heart rates. You'll be able to count these things. Why? Because this is why we are taking care of patients. You're not just taking care of some random person with a random disease. You're taking care of someone's daughter. You're taking care of someone's mama. You're taking care of someone's father. So it is really important to practice those skills as well as just have a handy timer on hand so that you can calculate and time those assessments appropriately. And so I'm not gonna lie, another reason why I keep my watch on is because, girl, I count my steps. I make sure I get my steps in, especially if I'm gonna be walking around for 8 hours during my clinicals. Yeah, we're getting our steps in. So having a watch is super important for multiple reasons. Okay, so number 2. So the second thing that is super important for me to have during my clinical rotations is my clipboard. Okay, this clipboard, oh my gosh, I love this clipboard. And I'm going to explain why. So it folds up into 3. So it's like a tri-fold situation, right? So it folds up into 3. But what I really love about it is it has so much information in the back in case that I need like a little refresher, especially being that I'm a student and I'm still learning. I feel like the more you have things in your face, repetition definitely helps to retain the information. So I'm going to share some information that is on the back of this clipboard. So in this upper right hand corner, we have normal ABG values, which are arterial blood gas values. And it tells you how much oxygen, carbon dioxide, and the pH of your blood. And so I really like this. Can't even see. I really like this chart because it's super straightforward and it helps me remember information in this corner. It has temperatures from converted from Fahrenheit to Celsius, which is really important. But in Epic, which is the electronic health record that we use, It does all of that for you, but just to have it there, because who knows if you're going to be working in a facility that has a big that converts Fahrenheit to Celsius. So just having it in front of you is super helpful. It has height to inches to feet, weight from pounds to kilograms, different conversion factors. It has the QRS complex here, which has to do with your heart. Okay, and then they talk about sepsis, and we have the pain scale here. We have BMI weights. So typically when we are getting the weight of patients, we'll see if their BMI is high or normal. And then over here we have pupil sizes, and then we have some lab values, which is super, super, super helpful. So I really love this clipboard. Okay, another reason why I like this clipboard is it folds into 3. And so it's super easy for me to just tuck into my side pocket in between me writing things down and me just having to put away my clipboard. Because when you're going into the patient's room, you're taking notes, you're listening to them, but you want to make sure you have all the information you need, and you typically need something to lean on, right? You need something to lean on. You can't just walk around with paper. I know some of my classmates, they walk around with little tiny notebooks that they put in their pocket, but I just like this clipboard because it gives me a lot of information and just help me retain that information. So and it's pink. Super cute and super helpful. Number 3. All right, number 3. My stethoscope. And let me get it. My stethoscope. So first things first is get you a stethoscope that you know is yours. Oh, this is a cute thumbnail. Look at this. So get you a stethoscope that you know is yours, whether it be a color, whether you put an air tag on it. Oh, they have pins also that you could put on your stethoscope, and you can put your name on it. So the pin essentially clips to your stethoscope, and then you can put your name on the side. Why? Let me paint a picture. I remember one day I was going around and taking care of a patient, and she was explaining to me that she's been in the hospital for about 10 days, and this is after I just did a full assessment on her, whatever. So she's like, I wish I could go home and just take a shower, because she was bedbound, she couldn't walk, she had gout, and then she had an ulcer in the bottom of her heel also. So it was super painful for her to walk. She's been in bed for about 10 days. She was like, I can't wait to take a shower. So I'm like, you know what, girl? Let's get back to you. I'm going to give you a nice bed bath. I'm going to put some lotion on you. Like, we're going to get back to you. And she was like, oh, my God. Like, thank you so much. We're going to change your sheets. All of that, girl. We're going to get you right. So I put my stethoscope down on one of the wild cards that I think maybe a nurse was using. I wasn't too sure. Child, after I finished giving this patient a bath, my baby was going. She was going. And it was this one too. I got it back. But yeah, so had I not had a color that everyone else had, I honestly probably don't think that I would have found it on a busy floor. And so being that no one else has this color on that floor, I was able to spot her out a few hours later.
2 hours later.
But nonetheless, I was really excited and really happy that I got it back. So, just try to distinguish your stethoscope, because it can easily get misplaced. With that being said, keep it on you. I'm a student. I'm learning. But keep your stethoscope on you. Put it in your pocket. Something. But being that I was giving a patient a whole bed bath, I was getting ready to, undress her, change sheets, I just wanted to put it away. But nonetheless, stethoscope. Another reason why stethoscopes are super important is because as a nurse, you're going to be doing assessments. You're going to be doing assessments. You're going to be doing respiratory assessments. You're going to be doing gastrointestinal assessments. And those assessments typically involves you auscultating, which means listening to sounds. Even when you're auscultating the abdominal cavity, right, we auscultate before we palpate. But yeah, when you're doing that and you don't hear any bowel movements for a few minutes, something's wrong. something's very wrong, or when there's too much vowel sounds. Those are key findings that there's something's going on. Number four. Okay, number four is, do y'all know what this is? Lip Dusty. So this is my scrub cap. Well, this is one of them. This is my scrub cap. Nice satin in the middle. We gotta protect the hair. But yeah, so number four, which is important to me, is a scrub cap, and I'm gonna explain why. As a student nurse, you're dealing with a lot of bodily fluids. Sometimes things are flying all over the place. I can attest to you that as a student nurse, I have been able and have the, oh my gosh, y'all, I can't wait to talk, because I'm gonna do a whole recap of this semester, especially this clinical season. But I have had the privilege that some NPs dragged me into a room or was so excited for me to stay with them. I was able to witness a bone biopsy, which was so cool. But honey, when I tell you there was a lot of blood gushing around, it was a messy situation. I had the privilege to also see a wound change, which was super cool, like a very deep wound where they had to pack and then use like a vacuum after packing it to continuously suction out. So I had the privilege to see that. And then nonetheless, I'm changing patients who may have had accidents. I'm cleaning them. It's just a lot of, just many fluids going around. And also, some days I may not feel like doing my hair. Why? Because I have to be at my clinicals by 6:45 in the morning. My clinicals are in Brooklyn, New York. I live in Staten Island, New York. So that means I have to be up by 4 a.m. in the morning to catch a 5:30 boat. I do my best to look my best in the morning, but like, to be honest, I'll keep a little cute curl at the side, or I'll keep, 2 little strands in the front, and I'll look like something, but very much, baby, my scrub cap is going on. Why? Because I want to be present. I don't really want to, fiddle around with my hair too much. And I want to be so focused on my patients, so focused on learning as much as I can, that I really don't want something like my hair to be a distraction from an amazing learning opportunity. So number 4 is definitely my scrub cap. And they come in so many. And you know what, y'all? I'm actually going to do y'all a favor. I'm going to link all of these below, because I think I got all of these at Amazon. Yeah. I'll link them. I'll put the link below for y'all. So yeah, my scrub cap, super cute, and they come in so many different colors and sizes. All right, y'all, so the last essential, very important thing that I think is so important when going into my clinical rotations at NYU's Accelerated Nursing Program is, drumroll, a right mindset. Yeah, maybe corny, but I'm going to explain why. So, I know you guys heard a lot of horror stories of maybe some mean nurses, maybe some mean instructors, mean patients, etc. But to be honest, at the end of the day, you're going there for your benefit, for your education. You're going there to treat patients. And so, I do not go into my clinical rotation until my mind is right. Like, I make sure that I prep from the morning of, from the time I wake up to the time I walk into the hospital doors, that my mindset is equipped to handle whatever comes at me. So what does that look like for me? First things first, I read my Bible and I pray. I have to ground myself in the word before I go anywhere, because God told me that this is for me. And if this is for me, can't nobody take it from me, no matter how nasty a nurse or how nasty an instructor can be. I just want to say that I've had an amazing experience so far. I have not gotten into anything with any nurses, nothing with any of my instructors. They've been amazing. They've been so knowledgeable. They've taught me so much. And so I haven't gotten into anything with anybody, and I'm super grateful for that, and I pray that that continues. I also pray that before I go in there, that I have instructors and I have preceptors that want to teach me. Like, that is my prayer. That is my prayer the night before. I pray that they are excited to teach me, that they can't wait to have a student nurse be amongst them. And it doesn't really matter too much about the patients, because patients come in all different types of backgrounds. You don't know where they're coming from. You don't know why they are so angry. But as a nurse, it's your job to listen. It's your job to understand and just be culturally sensitive to whatever it is going on. Whatever population that you're serving in that moment, it is your job to just be sensitive to that. You can be stern, but there's also a sensitivity, and so I think that you need to come with that balance. But coming in with a right mindset, I start with prayer, I start with reading my Bible, and then I hype myself up. I hype myself up until I get through the doors. Whatever music makes me feel good, that's what I'm listening to. I make sure I have my coffee. I make sure that I have the energy levels that I'm going to need to sustain a few hours of walking around, talking, learning. I come with a fire mindset. See, now I'm getting hyped, because like this is what y'all really need to do. It's not just, oh, let me just get up and just go. No. If this is a profession for you, you need to go in with the right mindset. You need to go in knowing that they're going to get the best version of me today. They're going to get the best crystal that they can today. Okay, so I gave 5 must-haves for going into any clinical rotations. And honestly, y'all, there are a bunch more. And I'll probably do a second part to this, but y'all let me know if you want one. So if you enjoyed this video, I would like a thumbs up and a subscribe to your girl if you want to be a part of this community. But I'm going to be having some more videos, some more shorter videos coming to you guys. Again, I really do want to give information that I wish that I had when I was looking for some information going into an accelerated nursing program, especially as a first generation college student. I don't want to say I don't have people around me that can give me education, because I do have mentors that I've sought out, and they have been very helpful to me on this journey. But everyone is not as privileged, and I definitely understand that. So if this information is helpful to you, or you know someone would benefit from this information, share it to them. I honestly, it is my pleasure to do this. I love to educate. I love to share my experience, and this is going to be an amazing journey, and I'm just excited to grow with you guys. So I love you guys so much, and I'll see you in my next video.